Patient Engagement Coordinator here at Cancer Care Nova Scotia, and my role is really about facilitating and helping to ensure that patient and family voice and perspective is brought to the table when decisions are being made about the cancer system itself. I think throughout this project, the patients and family members that I spoke to or that we connected with to hear their feedback and perspectives has all been very positive, and what I took away from it was how glad people were to have had the opportunity and how serious they were really taking their role and really wanted to do a good job and spend the time needed. And so they were appreciative that they had the chance to review and read some of the materials up front before coming to a focus group, or could do it from home and take the time they needed to go through a survey. And when people show up to the focus group with the document printed and highlighted and said, I kept this by my bedside and was reading it thoroughly for the last few days in preparation, you really know that people are taking it very seriously and wanting to do a good job and really provide insightful feedback. So then to hear it and be able to look at what does it mean, how can we incorporate it into the standards, or what does it tell us about how we need to educate people about the standards or about different aspects of treatment and surveillance. It gave us a lot of good information to work with.
My name's Peter Robinson, and I was a patient.
I'm Beth Robinson, wife of Peter, so I was responding as a family member.
My involvement in the standard review process was I wanted to be an active participant, and in the end, hopefully, it would make a difference.
And I would say it was similar for me as well. I thought it was a really wonderful opportunity to give voice to patients and family members about the process and to have a say in the standards that ultimately would be decided upon.
I participated online to complete the survey, and it was easy, and it was nice to be able to make some candid comments.
Yeah, I found the process very manageable. It was nice to be able to take part in the comfort of one's own home and to kind of think through, to respond at one's own pace. At the same time as I very much value the concept of the focus groups as well, and think that those are absolutely crucial. But certainly for our geographic location, it was really ideal to be able to do it from home.
I won't say everybody has their own story, but I think everybody does. And the experience, if you can get that transmitted into a standards basis, will help everybody in the future.
With respect to making sure that people are aware of surveys related to standards development, I think it's important to be mindful of the number of people in Nova Scotia who are dealing with colorectal cancer and other cancers. And so if there's going to be standards development that's going to involve the medical consumer, I think it's really important to make sure that people are aware of that. And so, really important to get some advertising that is accessible or accessed by the general population, including in the newspaper, including CBC radio, because the fact that we heard about this by word of mouth from a good friend was just fortuitous. We wouldn't otherwise have known, and I think it is really important that people get their stories out so that when decisions are made around standards, that they're really taking into consideration sort of the lived experiences of these people. I mean, that's bona fide research in my mind.
My name's Dorothy Barrett. I'm 63 years old. I'm a retired school teacher, and I'm a survivor of bladder cancer. I was diagnosed 6 years ago, and at the moment, luckily, I'm cancer-free. And I'm part of a Standards and Indicators Working Committee for Cancer Care Nova Scotia, and they're trying to develop standards for care as well as indicators to measure those standards. And so this has been going on since the fall, and I think that having patients involved is really important. It had been, as I said, 6 years since my cancer diagnosis, and last year I finally felt strong enough and able to do something positive again, and I felt that perhaps there were things in this area I could add to, so I put my name into a number of things and got a few calls and attended a few meetings, and then this came up. And I spoke to Sarah McDonald about the whole idea of, this committee and what I could possibly add to it. And we agreed that it possibly would be something I could fit in with. And so I joined, and it's been since the fall, and I think there's another year commitment to see where it goes from there and see how it fits in. On the committee, it's a group of professionals as well as 2 patients, or actually the other lady is a caregiver rather than a patient, and government, and then people from around the province that are also involved in cancer care in the different healthcare centers. And they're all very respectful people, they listen well, and they're very open to everybody's point of view. And committees don't always work so smoothly, but we're very fortunate that all of these people are there for a purpose, and they're there to list everybody's ideas and to try to develop a document that's going to be useful for everybody. If you're ready and able and have an open mind, I think it's really important to put your name forward and become part of it. It gives you a 2-sided perspective, one as the patient or the caregiver, whatever your role might have been, but it also, again, connects you with the professionals when you're perhaps not in such an emotional state. When you're the patient or the caregiver, there's a lot of emotions happening at that point, which takes you away from rationally looking at everything. At this point, I'm a little bit away from that, so now I can see other points of view as to how it all fits together.
My name is Debbie McIntyre, and I was diagnosed with rectal cancer 3 years ago. I have recently become a patient representative with Cancer Care Nova Scotia on some committees and have taken part in focus group and surveys. The focus group was a really good experience for me. I think one of the main things personally was it was an opportunity to meet other patients who had a similar diagnosis and had gone through similar treatments. And, to have us in the same room sitting around answering questions and sharing our experiences was a great experience for me. One of the things that I think was important that came out of that focus group is 2 of us in particular had particularly difficult experiences in an emergency. When we were telling our stories, I think it really made the healthcare professionals think, wow, are there other people who have had difficulties as cancer patients in emergency departments? I've been on a working group with another patient, and we are developing an education package for patients who have been diagnosed with colorectal cancer. One of the things myself and the other patient on the committee did was develop a letter to go with the package that outlined some of the things that we thought it was important to know at the time of diagnosis and to think about as you move forward through treatment. There would be several examples of issues that I think we brought up as patients where you could just see in the healthcare professionals that were at the table that you could see, or they would express that they would never have thought of that. One of the ones that we really both felt strongly about was dental care. I think everybody's aware that there are dental issues with chemotherapy, but the point that we were making that this needs to start right away and we have to get this message to patients, they hadn't thought of that.
Having been through cancer, you become very introverted for a space and time. You have to become introverted. That's what makes sense at that point. You have to deal with your disease. You have to figure out what you're going to do about it. It affects your whole life. It affects your family. It affects everything around you. And if you don't become introverted and deal with it all and go through your whatever it is, whether it's surgeries, whether it's therapies, whatever you need to do, and that's not something as an educator and as the person I was before I ever did. I always was looking at what I was doing for other people, not what I was doing for me. So I spent those years dealing with that, and I had to. So now I'm able to go back to where I was and look at what I can do for other people. And so it's enriching my life again. It's making me see that I've had those spaces where I couldn't, and now I'm able again, and that's what I want to do for this time. And none of us know what happens tomorrow. It might change tomorrow, but for now, this is what I want to do.
The reason why I continue to be involved as a patient and volunteer my time is because it really has a positive impact on my life. I think that as a patient who's been diagnosed with cancer and has gone through treatment, as I continue to try to enjoy this life as best I can, I want to make a difference. I want the experience that I went through to make a difference for future patients. It really, at the end of the day, I do feel like my experience has meant something, and that we can improve treatment in the future.
You can make a difference.